my name's Kennedy, and today I'll be teaching you the vital signs of a horse. So my equestrian friend here is P. She's going to be doing our little demonstrations with us. So basically, going over the vital signs for the horse is really essential for the horse's health because one, it's going to give you the best indicator of the health of the horse and also give you any kind of indication if the horse is sick, if they're colicking, or if they're just having a really bad day in general. So the first thing that we're going to check on her is her mucous membranes. So what the mucous membranes are is basically how wet her gums are and also being able to check in her eye how moist her eye is. So one thing that you want to look for is the color of the mucous membrane. So different colors that can indicate different things can be pale or white gums could mean anemia or shock. Yellow or almost like a orangish brown color could be jaundice. So that could be an issue within the liver. Another color that could be an issue is purple or dark red gums. That could also mean that she's getting a lack of oxygen, or also that could mean that there's something going on within the gut and she's not getting as much blood circulation through her gums. And the last one is fiery red or brick gums, and that could be an indentation of a illness or infection. So for her, we want her to have a nice bright pink gum, and also we want her to have a capillary refill time, which is basically putting your finger into the gums and seeing how long it takes for the blood to come back to the surface. So for her, you want her to have a nice pink gum. She's not happy about it, but as you can see, she has nice bright pink gums. There's no indication of any kind of illness or sickness going on for her. So she's not very happy right now, but to do the capillary refill, I'm basically just going to lift up the lid, push my thumb into the gums. And as you can see, it took about 2 seconds for it to come back. So the average time for the capillary refill is about 1 to 2 seconds. If it takes any longer than that, then usually the horse will be a little bit dehydrated, so that's another way that you can tell if the horse is hydrated or not. If it takes any longer than that, that is a serious issue because that means that the blood is not circulating properly through their mouth. So another way for you to measure the horse's pulse is actually on the leg. So right here behind the knee is actually the radial artery. So that's another way for you to be able to feel the pulse. It is a little more difficult than feeling under the jaw or measuring from back behind the elbow. And then another one that you don't want to be able to feel the pulse for is actually the digital artery. So the digital artery kind of runs right here back behind the hoof. If you do feel a bounding digital pulse, then that means that there's some sort of hoof issue within the horse. That could be anything from a hot nail, that could be an abscess, founder. If they're having any kind of navicular problems, then that could also be an issue. So the only places that you would really want to be able to feel the pulse is actually behind the knee from the radial artery and up here on the maxillary artery. So basically what we're going to do is feel for the maxillary artery. So the maxillary artery runs back through the back of her neck and down her jaw. So it's going to be on the inside of this cheekbone right here. So it's going to feel like an earthworm almost. So if the artery is my finger right here, you're going to put your pointer and your middle finger kind of just resting against it so that you can actually feel whenever her heart does beat. And the way to measure it is basically, since you want to measure it per minute, you want to count however many beats you get per 15 seconds and then multiply that by 4. Obviously, since 15 times 2 is 30, 30 times 2 is 60. So I'm going to wait till I feel something and then let my videographer know. Go.
Stop.
So she obviously was not happy with that. So I let go for a little bit, but the most that I counted for her was about 6. So 6 times 4 is going to be 24. So it's a little low for her right now. She is kind of tired and exhausted right now. So if she had been just worked or anything like that, then I would be a little more concerned since it was so low. If she just had any kind of exercise or just went to turn out, or if it was a hot day outside, maybe her heart would be beating a lot faster. So basically, just depending on the situation that the horse just came from, that's going to be a good indication of if the heart rate is going to be higher or lower than anticipated. So the next vital sign that we're going to be measuring is the skin pinch test. So The priority of the skin pinch test is to test the hydration of the horse, so it also goes along with the mucous membranes. So basically you can kind of put the two and two together, but this is also one to make sure that kind of like the water is flowing through her body properly. So what you're going to do, you're basically just going to take a little bit of skin, you're going to pinch it, you're going to pull it out, and then let go. And immediately within two to 3 seconds, it immediately went back to normal. So basically what you're looking for is tinting of the skin. So if her skin had stayed out like here for a little bit, then that would have been a little bit of tinting, and you would think that she would be a little bit dehydrated. If it stayed there for a long time, that could mean that the horse is a little older, or maybe they just have a lot of loose skin, so that is normal for them. But for her, she is younger, so it would be abnormal for her skin to tint up as much as a older or geriatric horse. So between 2 to 3 seconds is how much you want it to be flat and done and back to. So as I mentioned earlier, another way to feel for the heart rate is actually measuring closest to the heart, which is actually on the heart girth here and behind the elbow. So we're going to actually be able to easily read it with the stethoscope. And just as I was before, I'm going to be counting however many beats I get within 15 seconds. My camera operator is going to be telling me whenever 15 seconds is up. So we're going to make sure that's working. I'm going to go behind the elbow and lift up. It may take you a little bit just to find a pulse in the beginning. Go.
Stop.
So again, just as before, I got about 6. So 6 times 4 would be 24. So again, it is a little low, but again, she's been resting all day. She hasn't been outside or turnout or anything like that. So it's fairly normal for her. Being her keeper, she does have a fairly low heart rate in general. So if it is below average, it kind of just depends on what horse you have. And again, the kind of environment that they've been in, if they've been in work or if they've been in turnout, or the kind of weather that's happening outside also. So the next vital sign that we'll be going over is actually the respiratory rate. So normal respiratory rate for the horse is about 8 to 16 breaths per minute. So again, we're going to be multiplying whatever number we get by 4 after 15 seconds, because then that's going to add up to the minute. So what you want to do, you never want to look at the nostrils, because horses should always be smelling something. They could be basically just looking out for their surroundings. So you always want to watch the flank and how much they breathe from here. So just as you saw there, she took in a breath. It's going to be a lot slower than any other animal or human, so that's why the number is so low. So basically, I'm just going to wait until I see her take a breath. Once she stands still. Go.
Stop.
So I counted 3 breaths per 15 seconds, so 3 times 4 would be 12. So that's right in the middle of the range, so that is completely normal for her. If the horse had just come in from turnout, if they had been in exercise, or if it's come from a hot day, they would probably be breathing a lot heavier, so it could be more than 16. But if it's less than 16 or a lot more than 16 to like a really high degree, then maybe you should be looking at different vital signs, checking the horse, making sure that they're healthy and happy. You can check all the other vital signs to make sure that that one is just maybe just normal for the horse if it's lower or higher. So it completely just depends on that. So the next vital sign that we're going to be going over is actually gut sounds. This one's arguably one of the most important ones to check for if you think that your horse may be colicking. Colic can be a disease in the horses that could be potentially fatal if not caught as quickly as possible. So one thing that you want to check for, there's different quadrants on the horse. So this would be upper left quadrant, lower left quadrant, and then on the opposite side it would be upper right quadrant and lower right. So basically you want to make sure that they have a constant gurgling noise going on in their gut. If they have a pinging noise or kind of like a flicking noise, that could be an indication of an impaction colic. If they have really runny sounds, or it sounds like a waterfall or rushing water, that can be a sign of hypermotility, so that there's too much water going on in the gut. So again, you want to make sure that it's normal gurgling sounds, just like whenever you kind of are really hungry and your stomach starts to growl, something similar to that. So I'm going to be putting my left ear on her so that I can watch her hind end, because you always want to be cautious of the hind end, obviously, because they're horses. So I'm basically just going to be hearing for it in all the different quadrants, making sure that they add up. Sometimes you'll be able to hear some in one quadrant louder than the other, and sometimes you won't be able to hear much of anything. In here it is a little louder of an environment, so hopefully we'll be able to hear some normal gut sounds. They are also about to be fed, so she may be a little hungry right now. So upper left sounds completely normal. Lower left is completely normal, and then we'll check on the other side. This side's normal. And so is this one. So the last vital sign that we're going to check is actually temperature. So a normal temperature range for the horse is around 99.5 to 101.5 degrees Fahrenheit. So the first thing that we're going to do, we're going to have a digital thermometer. Digital thermometers do read a little bit low, so you want to take that into consideration whenever you are taking the temperature. The first thing you're going to do, you always want to be able to disinfect it before using it. So we're going to take our chlorhexidine solution here on a gauze pad and just gently rub the end off that's going to be inserted. Clean that off, shut this so that's not contaminated. And then obviously you don't want to just stick this in completely dry. You want them to have some sort of lubrication, so we're going to use just normal petroleum jelly, Vaseline, whatever you want to call it. You never want to be able to stick the thermometer in there, because that's just going to be another area of contamination and possible infection for the horse. So I'm going to scoop it up on my finger and then apply it to the thermometer as best I can. And then you want to make sure that you have a fairly good grip on it, because horses can actually suck the thermometer into the anus, so you never want them to accidentally lose it inside there. So some horses are going to be a little bit resistant to this, so you just want to keep caution. I know that she's going to be completely fine because I've done this with her before. So you turn on the thermometer, wait for it to read normal, stick it in. You want to push the edge of the thermometer over to the side so that you don't accidentally read any kind of poop or manure that they may have in there. And then you just wait for it to beep. Alright, so her temperature is 99.2, so it's a little bit low, but again, digital thermometers do tend to read a little low anyway. So I would guess that she's in the normal temperature range, so I'm really not concerned about any of that. If it is below 99.5 or above 101.5, then there may be an indication of possible colic. They may be sick, they may be injured also and have some sort of infection going through. But for her, that's completely normal, so I'm not going to be worried about that. So those were all the vital signs to be able to check your horse to make sure that they're as happy and healthy as can be. Remember, sometimes just depending on your personal horse or your lease horse, whatever horse you have, it's going to be a little bit higher or lower than those numbers. So basically just make sure to keep an idea of what the temperature of your horse is, their heart rate, breaths per minute, everything like that, so that you can constantly keep up with them throughout the time that you own them or lease them.